let's talk about ringing in your ears for a second. My name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and balance problems, which usually relates to the inner ear. While I don't treat ringing in the ears directly, I do have a lot of patients with this condition and have studied it extensively. So let's talk about what it is for a minute. So if you have ringing in your ears, the first question you need to ask yourself is there a bell ringing in this room? The answer to that is usually no. So where does this sound come from? Well, the real answer is it's a figment of your imagination. That doesn't mean your complaint's not real or that you don't really hear the ringing sound. It means that your brain is producing a sound that is not in the real world. So why does this happen? Well, usually it's nerve loss. There is a nerve called the cochlear nerve, cranial nerve number 4. There's a right one and a left one that takes vibrations from the eardrum and the cochlea and sends them to the hearing area of your brain. That area of the brain interprets these nerve signals into sounds. And usually, it goes off without a hitch and you hear what's actually happening in the room. But when something goes wrong with that nerve signal, your brain is interpreting something incorrect. A roaring sound, a ringing sound, a dripping sound, or a pulsation kind of sensation. These are all from nerve loss, and this is common with aging and other conditions. So a good example of nerve dysfunction that most people are more familiar with is the nerves of touch to the skin. If you sit on your foot for a really long time and your nerves of touch in your legs lose blood supply for long enough, they will lose signal for a minute. Then when you go to stand up, you feel these pins and needles in your foot. There's no real pins or needles touching your foot, but that's the sensation you feel. That's because the nerves send off this white hot noise signal to your brain when they lose their signal, when they lose their ability to send a signal. And your brain starts interpreting rogue sense of touch. So it starts feeling like you have pins and needles touching you all over your skin. Well, those nerves send signals about sense of touch. The nerves of the ear, the cochlear nerves, send signals about hearing. So whenever they start to malfunction and they are not sending the signal correctly, their white hot signal is a ringing sound or a roaring sound, and that's what your brain starts to interpret. Hope that helps some people to wrap their brain around it. I'll have some audiologists on here soon to discuss some treatment strategies.